Good day, guys. I'll be discussing OET speaking module, and we are going to use a practical approach. And this lesson is for nurses. Well, I've done several videos on writing, and these videos are well simplified and easy to understand. So if you go through those videos, you will discover that OET writing is the simplest module that you can ever think of. So make out time to go through those videos. Now, today we are going to discuss the approach for how we're going to approach speaking during the exam. So, as we know, the OET has four modules: listening, reading, speaking, and writing. The speaking section will be between you and the interlocutor. You will act as the nurse, while the interlocutor will act as the patient. So it's actually an act. You will simulate what is obtainable in your practice in the hospital. So this speaking module is actually divided into three parts. The first part is the warm-up exercise, where the interlocutor and you, both of you, try to familiarize yourself with each other. Usually this part usually takes less than 5 minutes. And here the interlocutor can ask you basic questions, things around it, things concerning you, things about anything at all that you can think of. Just normal conversation that you can have with anyone, the normal questions you can ask anyone at any time. So these are the things that should be asked. And this part is not scored, but this part is also recorded like the remaining parts of the test. After the warm-up exercise, then comes the first task. The first and second tasks, they last for maximum of 5 minutes each. But before each of the tasks, you will be given 3 minutes to go through the role play card that will be given to you. So you have to maximize the 3 minutes very well and use it judiciously to read and study the tasks so that you can know how to approach the task. The whole exam usually lasts for roughly 20 minutes. But for you to know what you are expected to do, so you have to understand the criteria that is used to grade you. So there are actually 9 criteria, and these 9 criteria are grouped into 2. You have the linguistic criteria and the clinical criteria. For the linguistic criteria, that's where you have the intelligibility. The intelligibility just clearly means how clear is your communication. Can the person you are talking to understand you very well? Can you pronounce your pronunciations, are they very clear? The way you pronounce words, are they clear? When you make expressions, the person you are talking to, do the person you are talking to understand these expressions? That's just what intelligibility is all about. The clarity of your conversation, how you understand the task that has been given to you, and how to follow the task. Now, after they also assess your fluency. The fluency is all about how free you can speak. Can you speak without pausing too much or pausing for a very long time? Can you speak without using a lot of all those fillers like just some different words people use as fillers just to buy time while talking. So the fluency help to assess this. Although for native speakers, they also use fillers when they are talking, but when you use those fillers too much, that's when it becomes a problem. So try as much as possible to reduce your hesitations and those fillers. Then the appropriateness of language. You should not use slangs. You should not use informal language. Although OET speaking is like a semi-formal setting, but that should not now make you to use informal expressions. Then they also assess your grammar and expression, the type of verb you use. Are you using plural verb for singular noun? Are you using a past tense for present tense? These are the things. So they assess your grammar too as you are speaking. Then these 4 criteria are the linguistics criteria, and they are scored from 0 to 6 each of the criterion. The second part is the clinical criterion, and this clinical criteria, and these criteria include relationship building. How are you able to engage the patient? Are you able to engage the patient from the beginning of the discussion to the end of the discussion, or were there some points where you and the patient there was a kind of a disconnect between two of you? So for you to express yourself very well, you must have a strong relationship with the person you are talking to. So you should be able to initiate the discussion and also follow through. Not when the patient is asking you a particular question, you are answering your task number 3 because you want to finish on time. Or when the patient is already on task number 3, you are still slowing the patient down, you are still on task number 1. At that point, there will be disconnect. The relationship between you and the patient will not be that strong anymore. Then they also want to know if you understand the patient's perspective. This is actually, in other words, what we call empathy. When the patient is scared, or the patient is fearful, or the patient is crying, or the patient is not happy or sad, do you put yourself in the patient's shoes? You can use some expressions to actually do this by saying, "Oh, I'm sorry. Oh, I know how difficult this must have been for you. Oh, I understand how you feel." So these are some of expressions that you can use, and your tone at that point should also reflect your expression. Then they also assess the way you structure the structure that you provide from the beginning of the discussion to the end. Were you jumping from number 1 of the bullet point to the number 4, or you follow this sequentially? The flow of your thought, or the flow of thoughts, was it okay? Was it in line? Was it logical? For example, you are discussing a case. From the symptoms, you should go to clinical features. From clinical features, you go to investigation. From investigation to go to treatment. You don't go from symptoms to treatment, from treatment back to clinical features, from clinical features back to history. So by doing that, your structure will not be right. They also assess how you gather information. As the patient is talking, as you are asking the patient question, are you asking the right questions? Are you asking the appropriate question that will make the patient to give you the right questions? Are you using close questions, or you are using open-ended questions? So when you're asking patient questions, it's actually advisable to start from open-ended questions and then narrow it down to close question. Not just that if you ask patient, do you have fever? The patient will say yes. You ask open-ended questions. How do you feel? Then the patient can now start talking and explaining things to you. Then how do you also give information as you're advising the patient? Are you polite enough? Or you are harsh on your patient? So you should not be aggressive. Your tone should not look aggressive. You should not be harsh. The way you talk to the patient, you talk to the patient in a polite manner, in a respectable manner. You should not talk to the patient in a way that the patient will feel harassed, or the way that the patient will feel as if you are talking down on the patient. And when the patient is talking, not at any given point in time, you're not supposed to interrupt the patient. Allow the patient to land first before you take over the discussion. Let's say the patient is angry and aggressive. You not just start saying, "Abeg, please calm down, please." No, you should just allow the patient to vet his or her anger before you now come in and answer, "Oh, please calm down," and then you continue with what you want to say. So this the clinical from number 5 to number 9, for each of them, they award 0 to 3 marks for these criteria. So you should know that things that you should do and things that you should not do during the speaking test. Do not fake your accent. Some persons will tell you, they assess your accent. It's a lie. Nobody assesses your accent. We all have different accents. The way we speak in Nigeria here is different from the way people in India, their accent in India is also different from ours. The accent differs based on geographical location. So you're not expected to have the same accent or try to mimic the way the white people talk. Don't try that. If you do that, you are undoing yourself. Just be natural and don't be too fast in your talk, and don't also be too slow. Now, I will advise those people that stammer, and also maybe you stutter while talking. At that initial phase in the warm-up exercise, when you are talking and they are recording your voice to know exactly how you talk or how you express yourself, at that point in time, you should try as much as possible to stammer a lot and also stutter a lot. If you are a stammerer, if you're not a stammerer, don't go and start stammering and then start stuttering. That will just ruin your whole day. I'm talking to those people that stammer occasionally or those people that stutter occasionally when they are talking. Is part of them. So at that point, don't try to conceal that part of you. Try to express it even better than it is on a normal. Try to exaggerate things at that point, so that by the time you are not talking and you are not stammering or you are stuttering, they will not now say, "Oh, you are hesitating" or something like that. So, and also, if you have anything that you are not clear about, always ask the interlocutor. When the roll card is given to you and you've read through and you are not clear about one or two things, ask the interlocutor to clarify things. Or if the rules and regulations that is meted out, you are not clear of, just always ask questions. And don't waste too much time on examination. Occasionally you may have a situation where you now say, okay, can I examine you? At that point, just say, can I examine you? And I say, okay, from what I've seen, continue like that and saying, let me examine you. Let me see your head. Show me your hand. This, that. You are wasting your time. All those words, they are not actually recorded. They are not assessed. They are not videoing you. It's just the audio they want to listen to, how you talk. Don't always show empathy when necessary. I've said this. When patient is in pain, show empathy. The patient is in pain, the patient is fearful, the patient is not in the right mood. Always show empathy. Use this empathic words and express empathy. Don't shout on a patient and don't use aggressive voice. And at the same time, don't also whisper. Use a very low tone, because if your voice is very low and it's not clear, it's not loud enough for them to hear and assess you. There is nothing they will assess. There will nothing that we use to assess you, and definitely will fail that exam. So try as much as possible to speak clearly. And if you didn't finish your task, it's actually okay. Don't beat yourself about it, and don't feel that you failed, because in the criteria there is no place that they said completeness of task and they will award no. Whether you finish the task or you did not finish the task, just don't feel bad about that. So now we are going to go into practical sessions now. There will be we are going to play nurse's roll card. First will be the warm-up part, and second will be the role play card. So we'll start with a warm-up exercise. Now we go to the first part, which is the warm-up part.
Okay.
I'm Mr. Tom. Please, what's your name?
I'm Faith Evans.
Okay, Nurse Evans, you are welcome.
Thank you.
Of course, you read nursing in the university.
Yes, I did.
Yeah, which university did you attend?
I graduated from the University of Nigeria. That was in 2015.
Oh, that's lovely. You
Thank you.
would have done a lot of courses, both compulsory and optional courses. But is there a particular course that you so much loved when compared to other courses that you offered in the school, in the university?
Yes, I especially like the part where we had to deal with patient care, where our studies was transferred from the classroom setting into the clinical hospital setting. That was my most enjoyable model, because then you bring to life what you were taught in class, and you see the differences that what you were taught in class brings to people's life. It was quite fulfilling.
That's nice. Okay,
Thank you.
but apart from the academic activities, were there other extracurricular activities that you were engaged in, like any sports at all that you so much enjoyed too?
When I was much younger, I used to enjoy doing track races, especially the short distance 100 meters.
Uh-huh.
but with the stress of schooling, I couldn't keep up. But I did pick up an interest in taking pictures,
Oh,
especially nature.
like,
Yes.
oh, that's lovely. I guess you have the some of the album and the pictures at home.
Yes.
Okay, that's lovely. Well,
Yes, I
um,
do.
what else
Thank you.
area do you want to venture into in nursing? Because I know that in nursing you have different specialties where you
Mm,
can actually specialize. Do you intend
mm.
specializing in a particular field?
Yes, I intend to go further to specialize in midwifery
Okay,
because I really enjoy it. Yes.
okay, wow, that's lovely. You want to start catching babies?
Yes, I do.
Okay, it's okay. So this is the end of section one. That's how the warm-up exercise goes. And from this warm-up exercise, we've been able to know how the candidate speaks, the tone, the verbosity, how this candidate actually, the fluency of this candidate has been ascertained in this warm-up exercise. You can see the questions. The questions can come from any angle, just common question that you can answer, that somebody can stop you on the way and ask you, so you answer those questions. So it's not really, the questions are not really hard. They are just normal questions that anybody can ask you. And this part of exam we just concluded does not have any mark allotted to it. Now we are going to go to the real exam. That's playing playing the real role play card, and it will be taken by to be played by a nurse. So let's listen.
Good afternoon, sir. I'm Sister Evans, your home care nurse. How would you like me to address you?
Good afternoon, nurse. Mr. Thompson.
Mm. Nice to meet you, Mr. Thompson.
Thank
I'm
you.
here to check on your well-being and also address any health concerns you might have. Is that fine with you?
Yes, I'm glad you came, nurse. To be honest with
All right.
you, I've been sad for the past 3 days. As you all
Mm,
know, that I've been suffering from stroke, from hypertension to stroke. And now, 3 days
mm,
ago, I just noticed that I've been urinating frequently and it
mm,
makes me uncomfortable at night. So I don't know
mm,
if these symptoms are related to the stroke I'm having.
mm. I'm really sorry, Mr. Thompson. You do have a lot of things going on at the moment, especially with the stroke and your new onset frequent urination. But I want you to keep your mind at rest. We will try to find out what this could be. But from what you told me, it does sound like maybe you're starting to develop something we call diabetes. Do you know anything about it?
Well, I've heard people talk about diabetics before, but
Mm,
not that I know so much about it. But my concern now, are there investigations or tests that one can use to know if I really have this diabetes? And if it turns out that I have diabetes, is this diabetes, is it treatable?
mm. All right, Mr. Thompson. Diabetes just means there's a lot of sugar in your blood. So we do have tests that can be done. I will do a urine test now
Mhm.
to check if there's any glucose, that is sugar, in your urine.
Okay.
And then we'll also have to take some blood of the glucose in your blood and also check how well your sugar has been in the past 3 months. But I want you to put your mind at rest, Mr. Thompson. This diabetes is very well manageable. There are pills you could use. You could you could also be on the injection for diabetes, which we call insulin. And we might also have to make some changes to your lifestyle. Do you think you'll be able to do all this?
Nurse, to be honest with you, I'm really not. I'm so much worried and
Mm,
somehow feeling terrible because I've suffered a lot.
mm,
I've had hypertension for years, stroke, and
mm,
now this disease again.
mm. Mr. Thompson, please put your mind at rest. You won't be alone through this journey. I'll be here with you to keep addressing any problems you might have and to also minimize the effect of all your illnesses, including this new one, on your health in general. So you're not you, and even the doctors in the hospital will also work with you. Is that fine?
Yes, but I'm concerned. You talked about effects. Are there complications as I already have hypertension and stroke? Will this
Mm,
diabetes complicate things for me?
mm. All right. I wouldn't like you to start worrying about that because most of these complications usually occur when the diabetes is not well managed. All right. But like I said, you won't be alone, so we will likely have you under good control. But when diabetes is not well managed, you could have complications like maybe you have a wound that refuses to heal, which you call the diabetic ulcer. It could affect also blood supply to your eyes and affect your vision. It might even also affect your kidneys. But please don't worry about all this. These are extreme cases when the control is poor. Okay.
Okay.
Mm. But for now, Mr. Thompson, I would also like you to go to the hospital so you can see the doctor, so you can take the blood test and also check you further to see if there could be other things that might be wrong. Do you think you'll be able to do that?
Well, I don't have any other choice. I just have to keep
Hmm.
struggling.
All right, Mr. Thompson. But just to go through everything again so that I'm sure you haven't forgotten what we discussed, I'm going to take some urine sample from you now to check if there's any sugar in your urine. And we'll also have to take you to the hospital so you see the doctor and have some investigations done. Okay?
Okay.
Have you got any questions for me?
Not at all. I'm really grateful and I appreciate your help.
All right. Nice to meet you again, Mr. Thompson.
Thank you. So this basically how the exam goes, and if you actually listen to the candidate did exceptionally well. She was very fluent, and she didn't use ambiguous terms. For example, she explained all this terminology like diabetic ulcers, retinopathy, and nephropathy without using these words. Rather, she explained it the way the patient will understand. And most of these, like glycated hemoglobin and the rest, she did not use them. She was very she used simple terms that the patient will really understand. And if you actually notice this candidate, she was able to express a lot of empathy to a point that the patient himself was now so relaxed, and she believed in the nurse. So you can see this OET speaking is actually very simple. It's just for you to follow those criteria judiciously, and as you practice over and over, you become better. I wish you, every one of you, the very best, and I believe um, the more you practice, the better you become, and you will definitely ace this exam. Thank you for listening, and our next video that I'm going to make will be on OET listening, how we will tackle it. And please don't forget to subscribe. Click on the subscribe button so that anytime I make any new video, you will be the first person to be alerted. Thank you. Bye.